Government directs private centres to pick up pace of vaccination.
The slow pace of COVID-19 vaccination by private centres in some states was a cause of serious worry, said Union Health Secretary Rajesh Bhushan on Wednesday. He had directed the states to review the status and progress of vaccine procurement by these centres on a daily basis, Mr. Bhushan observed. Chairing a meeting with health secretaries and senior immunization officials of 15 states' union territories, he noted that many private COVID vaccination centres had not placed any indent for the earmarked quantum of vaccines. Mr. Bhushan said he had directed the states to ensure that indents for the earmarked quantum were quickly placed with the vaccine manufacturers. Nodal representatives from vaccine manufacturers Bharat Biotech and Serum Institute of India were also present.
Private sector needs to step up.
The state governments and the PCVCs were advised to ensure that the gap between the indented quantity and payment towards their procurement was reduced to zero. In some states, the quantity paid for had not been physically lifted by the state's PCVCs. They have to quickly ensure the lifting of the dispatched doses, the Health Secretary stressed. A release issued by the Union Health Ministry said that in some states, wherever vaccine doses had been lifted by the PCVCs, their actual administration of vaccines was seen to be less than the quantity lifted. The states and PCVCs were advised to review this and ensure that the balance of unutilized vaccine doses were quickly administered. The Health Ministry said more than 39.59 crore doses have been provided to the states' UTs so far, through all sources, and a further 30,250 doses were in the pipeline. Of this, the total consumption, including wastages, is 38 crores 7,68,770 doses, as per data available at 8 a.m. on Wednesday. More than 1.51 crore balance and unutilized COVID vaccine doses are still available with the state's UTs and private hospitals to be administered, it stated.
Minister on vaccine shortage.
Union Health Minister Mansukh Mandavia has rubbished allegations by state governments of vaccine shortage due to the central government not ensuring adequate supplies. 11.46 crore doses of vaccine were made available to states' governments in June so that vaccination can be done through government and private hospitals, he said in a tweet. This availability has been increased to 13.50 crores in the month of July. The states knew very well when and in what quantity they would get the doses. The centre had done this so that they could chalk out the vaccination work up to the district level by planning properly, and people did not face any problem, he noted. In one of his series of 6 tweets, he stated, regarding the availability of the vaccine, I have come to know from the statements and letters of various state governments and leaders. This situation can be better understood by an actual analysis of the facts. Useless statements are being made only to create panic among the people.
Good morning, ladies and gentlemen. I am Major General Rajesh Sahai, and I am part and a consultant of UPSCLOUNGE. We are going to train you. We are going to train you to ensure and assure that you get through the IAS. How are we different from the rest of the people? See, I have a note in front of me. I have crushed this note. It's a 500 rupee note. I open this note and I make it absolutely straight. The wrinkles and the crinks in this note have been removed, right? The value of the note remains. You are the value, and we are going to dig deep into you. Absolutely dig deep. And what does the dig stand for? D is our training is going to be deliberate, inspired, and G, we will make you grow. It is going to be a life-changing experience. I spent 40 years in the army, I have learned the tricks of the trade. I am also a board member of the UPSC, and I have been an examiner of all the CSE papers, so I know what is required. Join us and you shall make it. That is my assurance. Jai Hind.